Yeah, we certainly do. And something else we also do is we take care of your well-being. And since it is Wellness Wednesday, Ewan is about to find out about the effective and affordable healthcare available at Medicare, taking a different approach to your healthcare.
Once again, welcome to your Wellness Wednesdays with Medicare right here on your Feel Good Breakfast Show. Today's topic, we're talking about medical aids and healthcare, but the affordability thereof. And once again, we are joined by CEO of Medicare, Knapp. Tim, thank you very much for joining us once again this morning on the couch here on your Feel Good Breakfast Show. I love this topic, affordability of healthcare. It's a big topic, I think, for everyone. First and foremost, what's happening with regards to medical aids in South Africa?
Yeah, I think it's a complicated question, right? And certainly you hear lots of headlines all the time about how medical aids are so unaffordable, and the costs are escalating. I mean, the reality in South Africa is there's about 8 million people who are on medical aids, right? Which means there's 45, depending on how many people you want to count in South Africa, but 47-ish million people who are paying out of their own pocket. Of those 8 million people on medical aids, actually very few of them have got comprehensive medical aid plans, right? So most people are still paying for primary healthcare, everyday healthcare out of their pockets. And I think we all know the trends that those medical aid costs go up 10, 15% every single year. There's massive trends about people, what they call downgrading their plans every single year, right? And actually trying to stay at the same price point, but actually reducing their benefits. So healthcare affordability is a massive issue in South Africa.
Absolutely, especially if you also can't afford a medical aid, and just your medical day-to-day expenses are very, very expensive as well. So when it comes to the services offered by Medicare, for somebody that's not on a medical aid plan or a hospital plan, how can you help out in terms of the cost around medicine?
So it's a huge thing for us. I mean, we like to say, everyone has a medical aid savings account, just most people sit in their pocket, right? And, we're trying to build our business around helping people manage that healthcare expense, right? And I think there's three ways that we think about value in healthcare, right? So the first one is you need to consult with healthcare professionals. And the way that we've built our system, again, you can come and consult a pharmacist for free, right? And if there's products that the pharmacist can help you with, that's what you're going to pay for. Second way is to actually consult a nurse, right? Our nurse consults range from somewhere between about 50 to 100 Rand, depending on exactly what you're doing. You can get, some people will run off to see a general practitioner to get their blood pressure and their cholesterol checked. We can do that at a fraction of the cost sitting in our clinic. Same with a baby, for a baby wellness check or for immunizations. You don't have to go to a pediatrician or even a GP to do those things. We can do those things with our nurse, right? The third level then is doctor, right? And the average doctor consult in South Africa probably is between 350 and 600 Rand. Our video med service compares very favorably to that, right? It's a very affordable, doctor service, right? So that's on the healthcare professional side. I think the second way is on medicine. And we can talk a little bit about, medical aid pricing and cash pricing. We aim to have our medicines be very affordable. The third thing is really the great value stuff in our front shop, right? And we run a ton of promotions. We have a big month-end madness promotion at the end of every single month. We know when people have had payday, to actually be able to bring some deep cuts and actually offer some real value at that period of time. Yeah. And then we've got another basket of products that are just well priced all the time. So you don't have to try to time your shopping at the exact period when you get paid.
Because those things are needed. And
they're needed, 3 other weeks of the month, right? Exactly.
But for those who can afford medical aids, how does Medicare interface with the different medical aids in South Africa?
Yeah, so I think ourselves, like many of our independent pharmacy brothers, we have contracts with pretty much all the major medical aids in South Africa, right? There's very few that actually we don't have a contract with. And those contracts have rates that are essentially the same as the big corporates. I think there's a perception out there that you can't go to an independent pharmacy and you can only get your medicine at a corporate. That's not true, right? And it's certainly not true that the price is different either, right? So I mean, we are a great destination to be able to pick up your medicine at a convenient place and at an affordable price.
Yeah. Taking a look at the video med service that you mentioned earlier on, that, and I'm glad to hear, I mean, you can get a consult at a fraction of the price that you would normally pay when you are going to see a doctor. How does it work with regards to your medical aid? Can you claim that consultation back from the medical aid if you are on a medical plan?
Great question. So at this point, no. So this is a service that's quite new to the market. Right now, this is a cash-based reimbursement service. Getting new services reimbursed by medical aids is quite a process. Right now, we offer simply cash-based consults. We are talking to every major medical aid in the country. They're very interested. There's quite a process to go through to actually get this thing reimbursed, and we remain very confident and optimistic that it will happen sometime during the course of this year. But at this stage, it's a cash-based consult.
But I think it's a great service for the fact that you can get it under one roof with your pharmacy, with your nurse, with the doctor. And I think this is what sets it apart in terms of, the cost that you have to kind of amount to if you have to do these things separate.
I think as we said at the beginning, given that 47 million South Africans are paying for healthcare out of their pocket, that's not a massive concern for us, right? I think even if you look at the other 8 million South Africans who have medical aid, I don't know very many people whose medical aid savings account lasts beyond June, right? So if you manage that differently, you can still use our cash doctor service and actually just use your medical aid savings account to pay for your pharmaceuticals and your drugs, right? And you can make that medical aid savings account last longer. At the end of the day, I think people forget sometimes that the money in that medical aid savings account is actually their own money that they've paid in there, right? And so you don't have to take everything out of, cash in that medical aid savings account for everything that you do. That's personally how I run, my family's medical aid savings account, right? Actually reimburse the medicine through the savings account and actually pay for the doctor myself.
Exactly.
Because it's so much, more affordable than I think seeing a traditional GP.
Otherwise, like you said, come June, it's all empty. Tim, thank you very much for joining us this morning, unpacking it and helping us understand the affordability with regards to medical services at Medicare. That's it for your Wellness Wednesdays with Medicare right here on your Feel Good Breakfast Show.
Medicare, reinventing pharmacy for you.